afternoon, Dr. Abhishek. Welcome to the Oncology Summit 2025. So, we have a few questions for you. How do you see the integration of mental health, nutrition, and survivor counseling influencing cancer treatment outcomes among Indian patients today?
First of all, thank you. And it has been a great conference. I was here moderating a panel discussion on hematological cancers. So, as we know that cancer is a very it's a chronic disease. That means it's not like your heart attack where you get an instant and everything is cured. So it's a chronic disease requiring a very long treatment. Generally, a lot of patients they undergo surgery, they undergo rounds of chemo, they also undergo radiation. In blood cancer, also patients are undergoing chemotherapy, targeted therapy, sometimes stem cell transplant. So this long treatment it takes a toll on the patient, particularly the mental aspect of it, because finances are still a big concern in Indian setting, and whenever patients are getting drained of their finances, it takes a toll on them. Plus, there is a physical toll because of the disease itself as well as the treatment part. Some of the chemotherapy that we are giving, it causes hair loss, sometimes mouth ulcers, diarrhea. Patients sometimes are bedridden. So it has a physical as well as mental aspect to it. So it is very important, like in our hospital setup also we have a different an onco psychologist who's there continuously counseling the patients, because sometimes these patients and their caregiver, they are often what do you call it, they don't have people to speak to. They are battling a much bigger battle inside as compared to the cancer also. Sometimes they need somebody to speak to, not only the treatment aspect of it, but also the emotional and psychological aspect of it. And it does help big time. Sometimes there are patients who undergo regular therapy sessions, particularly the psychological therapy sessions. It does improve the mental makeup of that patient, and they become stronger to fight the cancer or its treatment in a better way. So we have personally experienced it, and there are huge data set and research backing it up, that if you're doing a good psychological counseling which improves the mental makeup of the patient, it improves the outcome. Coming to the nutrition which you asked, so nutrition is I know there have been a lot of very I would say irresponsible comments from some of the celebrities regarding the nutrition in cancer. So first thing we need to understand is nutrition does not cure cancer. So just like cancer treatment, I told you about chemotherapy, radiation, bone marrow transplant. Similarly, nutrition is also one of the pillars of cancer treatment, but it alone cannot treat cancer. Like going on some fat diets, that removing carbohydrate altogether, removing sugar altogether, that does not tantamount to cure of cancer. A nutritional counseling is important because to withstand the cancer treatment, you need to be healthy, you need to eat healthy, you need to take your macros and micros. Just like for a normal human being, you need to take in your macros and micros probably in a much higher amount as compared to your general average population. So we do have a dietitian in who takes rounds with us. We identify the needs of the nutritional needs of the patients, particularly whenever we are taking the inpatient round, because there are a lot of challenges which happens in a cancer treatment. Because not only the patient does not feel like eating, sometimes they have mouth ulcers and all, which precludes them from eating normally. Sometimes their cancer is located in the food pipe or in the stomach, which prevents a normal swallowing of the cancer patient. So we every patient is different. Some of the patients may require placement of an NG tube. Some of the patients may be totally on a liquid diet for maybe few months, and we need to individualize their calorie amount. We need to individualize what amount of protein intake they need to take. We also need to individualize what are some of the micronutrients missing from their diet that can be replaced. So these are the holistic thing, how nutritional and mental well-being impact the treatment of a cancer patient.
You mentioned financial tolling for the survivors and the families of them. What steps do you recommend in a country like India that can be taken to make cancer treatment, diagnostics, and aftercare more affordable?
So that is a very difficult question to ask from an oncologist's perspective.
Anything that comes in your mind personally.
So yeah, I think what is the need of the hour is that as we were discussing inside also, that majority of the cancer care currently today, it is being handled by the uh, private hospitals. There is a When I was working in AIMS, I was doing my residency, I was doing my cancer studies. I used to see a lot of patients coming from Bihar, Lucknow, UP, far-flung areas, coming and getting their treatment done. So, can you imagine how difficult it is for those patients? Cancer is a long treatment. They have to stay here for 6 months' time. So, for those patients, they are coming here because there is a lack of facility over there. There are not good hospitals catering to such patients. They are diagnosed. They can diagnose it, but then they refer. Okay, go to AIMS, go to PGI Chandigarh, go to Tata Memorial Hospital. So what happens is he comes here. Even the treatment is free, but what about the livelihood? He's losing the livelihood. He does not know that in the next 6 months what is going to happen to him. So there are daily wage workers who are earning in the morning and feeding their family in the evening, and that they are not able to provide. So the important thing is empowering our PHCs and community health centers. Okay, what is the recurring treatment in a cancer care? It's the chemotherapy. Patient has to come again and again for a certain thing. Surgery, okay, I understand. Patient goes once, get his surgery done, maybe stay there for say 10 days. When he recovers, he comes back to his hometown. But it's the chemotherapy for which he has to go again and again and again. And that is what takes a big toll. So if we can empower, or if we can train our MD or the CMOs who are sitting in the district level. So there is a concept of district cancer care which has recently been launched in this year's budget by respected Prime Minister Modi, where you are empowering the district hospitals to take care of the cancer patients. If that can be done, that is great. Person who is affording the cancer treatment, who's affordable, he can go to Mumbai, he can go to Delhi, he can go to Chandigarh and get his treatment done. But a person who does not have an access to good finances, that cannot be done. Regarding the healthcare cost, I think if we have everything indigenous, the cost will decrease. A lot of the drugs which are costly are the patented drugs. If we have good biosimilar, we have good pharma companies, good R&D that is available in India. If we are doing those biosimilar studies, if we are doing clinical trials which matches the results of the drugs that are already available, patented drugs which are available in the West, we can bring down the cost. I'll give you an example of a drug called as rituximab. The original rituximab, when it was launched, it was costing 1.5 lakh rupees every cycle, every 3 weekly. But now we have generic rituximabs, very efficacious ones from good reputed Indian companies, which costs you 7,000 rupees. So can you so this R&D needs to come from our healthcare industry, our Indian pharma companies. So unless until you start making all those products in India, those things are not going to get cheaper. And for that, we need help of the government to empower R&D or the research methodologies, not only for the doctors but also for the companies, where it should be mandatory.
That was a lovely answer, Dr. Abhishek. Thank you so much for your time. Thank you.